I didn't choose Lyme disease, and if you want to know what it's like to have a front row seat on the doctor side, knowing what it's like to treat people for 25 years, you should check out this video. It's also why I'll never quit Lyme disease. You see, I didn't plan this. I never set out to become a Lyme doctor. But somewhere along the way, when the symptoms didn't add up or when the standard treatments kept failing, and when patients were being told, it's all in your head, something in me refused to accept that. And that's where the universe made the choice for me. Over 10 years ago, I started noticing a pattern. Actually, it was longer than that. It was in 2006. I've had patients come from all over the world, every state, 6 continents, and they come in with impossible to diagnose symptoms like fatigue. It was soul crushing and joint pain that looks like rheumatoid arthritis and neurologic issues and mitigative symptoms and mystery illnesses that no one could figure out. I mean, one patient had heart palpitations, another had tremors, sometimes they had fibromyalgia, and then another one with multiple sclerosis type symptoms. Different names, different labels, but something told me that it was all connected. And that's when I started really delving into and evaluating and studying Lyme disease, and everything changed. You see, it's the great imitator. It's a master of disguise. We call it the great imitator because it looks at 40 to 60 different main symptoms. I mean, if you put Lyme patients in a room, you get 50 different symptom profiles. And that's why the standard diagnosis of one cause, one diagnosis falls apart, because Lyme disease doesn't follow the rules. It can mimic arthritis, heart disease, neurologic conditions. I feel that it even can mimic, and that's what the white lesions could be in ALS, or what the white lesions are in multiple sclerosis. In fact, there was a study that almost all of the ALS patients, when they biopsied them, they found that they had Lyme disease. And I don't think that's a coincidence. That's called paying attention. So I decided to dive in. And this is where the passion rises, the clinical conviction. I read everything. I studied experts. I spoke to so many experts and the vitamin C guru, Dr. Levy. And more importantly, I started treating people in the trenches. I didn't rely on outdated CDC criteria or Western blot that only lights up if you hit 5 bands. I started using research, medical testing. I love doing a medical research process in our office called medical microscopy. I looked at exposure to history, I looked at clinical symptoms and blood tests, and I wasn't scared to look at intuition. And here's the thing, when we treat Lyme patients like people, we find their lowest common denominator. We find the thing that's imbalanced and we put it together. I feel like they get so much better. I mean, I'll never forget one of my patients. Her labs came back, traditional Western blot, 2 positive bands. The system says, well, that's not enough. And her doctor told her, hey, it's all in your head. He prescribed antidepressants. And her body was screaming for help. So we did our evaluation and workup. We found a lot of the markers, indicators, the symptoms, and even the exposure history, and we treated her like a patient. She started to heal. And that's the part most people don't understand. Lyme isn't just a bacteria, it's a breakdown of your immune system, of your energy, of your hope. It invites co-infections like Babesia and Bartonella and Mycoplasma. And unless you treat the whole person, you're just spinning your wheels. So here's what I believe. Lyme is not an antibiotic deficiency, and it's immune deficiency, a nutrient deficiency, an electron problem, an energy problem. And if you want to heal, you need to rebuild. You support the immune system, you flood the body with vitamin C, you repair mitochondria. It's really important to balance hormones, you fix the terrain. A famous medical historical figure, Louis Pasteur, said the bacteria causes disease. And that's where a lot of medicine goes after. A contemporary, and actually a hero of mine, Antoine Beauchamp, said, it's the environment that matters. And I believe that Beauchamp was right. You fix the terrain, and the infection can't stay. Now, I've seen people get better, not overnight, not always quickly. Sometimes it takes 6 treatments. Sometimes it takes 70 treatments, but I believe that healing's possible. And that's why I do what I do. Not because I chose Lyme, but because no one else could help those patients. And the Lyme patients found their way to me, and I couldn't turn away. So I'm Dr. Jason West, and this is what I believe. This is why I'm a Lyme doctor, and I'll never stop fighting for people who the system gave up on. Now, if you want to start a healing journey or this lines up for you, it resonates, you can download our free guide. I believe it's the missing piece at www.lymefighter, and let's figure it out. Let's do it together. You're not alone, and I certainly don't believe that your diagnosis, and if you balance the body, if you reset the nerves, if you give building blocks, if you have a stress outlet, if we focus on good food, good air, good water, good nutrients, and then bump the system with some aggressive treatments, I believe that you can get your life back and your Lyme away. I'll see you guys on the next video.